Could something you touch every day quietly change how your pregnancy unfolds?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're looking at how exposure to PFAS, so-called forever chemicals, can disrupt your placenta in the first trimester, when most miscarriages occur, and when birth defects, which affect 1 in 33 babies and are the leading cause of infant death, take root. I'm Ethan, and I'll guide the questions so you can apply the findings to your daily life right away.
I'm Alara Sky. PFAS are in thousands of consumer products, and they persist in your body for years. Researchers in Germany recently analyzed 31 placentas from 7 to 11 weeks of pregnancy, then recreated a real-world mix of PFAS to test on placental cells. That approach matters because we aren't exposed to single chemicals. We live with mixtures.
A key part of their method was using LC-MS to measure chemicals and then exposing both flat 2D cultures and 3D spheroid models that mimic early placental structure. The mixture included PFNA, PFOS, PFBA, PFOA, PFHXS, and PFDA, in ratios matching what was found in tissue. Even legacy compounds like PFOS, phased out years ago, were still present, underscoring how persistent these substances are.
The findings were direct. In 3D models, placental cells showed abnormal invasion patterns. Some over-invaded the uterine lining, others became less invasive. Either way, you risk impaired implantation dynamics. Hormone output dropped as well. Beta-hCG, which supports progesterone production and pregnancy maintenance, fell even at the lowest tested PFAS concentration. Gene-level signals tied to cell death and growth were also perturbed.
That combination, disordered invasion, lower beta-hCG, and altered growth and death programs, points to a placenta that's functioning but not optimally. The authors urge regulators to assess mixtures, not just single compounds, because the effects seen here emerge from a blend that mirrors real life. That's a practical shift you should want, reflected in public health policy.
There's more. A National Institute of Environmental Health Sciences line of research examined PFBS, a short-chain replacement for older PFAS. The data linked PFBS to impaired formation of placental blood vessels, reduced blood flow, and a higher risk of preeclampsia. Short-chain does not automatically mean safer. Substitution can preserve convenience while carrying measurable pregnancy risks.
Epigenetic changes are another path of harm. In a study of 151 mother-infant pairs, higher PFAS levels, especially PFHXS, were associated with altered DNA methylation patterns in the placenta. Many affected genes govern growth and cardiometabolic processes, and some are involved in neurodevelopment. That suggests PFAS can program aspects of your child's health before birth.
It helps to know how we got here. PFAS chemistry dates to wartime research in the 1940s and later exploded into everyday goods because it repels water, grease, and stains. The EPA now tracks more than 14,000 PFAS. Blood monitoring has found PFOA and PFOS in 99% of samples, with average half-lives of years. Strong carbon-fluorine bonds make them extremely resistant to breakdown, inside you and in the environment.
Your biggest exposures are often mundane. Cosmetics frequently contain PFAS, like PTFE and perfluorodecalan. Non-stick cookware uses PTFE coatings that can release compounds with heat. Historically, PFOA was used in making PTFE, and some newer substitutes have raised similar concerns. Grease-resistant food wrappers, some store-prepared food containers, and even certain yoga pants and leggings have tested positive for fluorinated markers.
Water deserves special attention. In a Swedish study covering 256,659 births from 2012 to 2018, higher PFAS levels in drinking water were associated with nearly triple the risk of nervous system defects and a 50% increase in chromosomal anomalies, with additional signals for urinary system defects. If you're pregnant or trying, treating your tap water is one of the most impactful steps you can take.
Effective filtration options are well established. Reverse osmosis pushes water through a membrane that removes PFAS efficiently, though it wastes some water and costs more upfront. High-quality activated carbon filters reduce PFAS when replaced on schedule. Ion exchange resins bind these molecules as water flows through. Emerging approaches using lignin-based adsorbents and membrane distillation show promise but aren't standard in homes yet.
Beyond water, you can reduce daily contact points. Replace non-stick pans. Even Teflon-free ones may rely on PTFE with ceramic or enameled cast iron. Skip stain-resistant treatments on carpets and upholstery, and avoid flame-retardant finishes where possible, especially in baby products. Check your personal care labels for fluoroterms or PTFE, and choose alternatives without those ingredients.
Food handling matters. Don't heat food in plastic or cover it with plastic wrap in the microwave. Heat accelerates leaching. Transfer leftovers to glass or ceramic before reheating. For packaging, minimize contact with grease-resistant wrappers and eat off real plates when you can. These are small, repeatable decisions that lower cumulative exposure.
One nutritional tactic is supported by findings in the article. Add beta-glucan-rich foods: oats, barley, mushrooms, seaweed. In 4 weeks, beta-glucan intake was associated with about an 8% drop in PFAS levels, likely by binding some of these compounds in your gut for excretion. It's not a cure, but it's a realistic food-based step you can put on your next grocery list.
Expect trade-offs. You won't purge PFAS overnight because of their multi-year half-lives, but you can move the trend in your favor by combining better water, smarter cookware and packaging choices, fabric decisions that avoid stain-proofing and flame retardants, and personal care products without fluorinated ingredients. Each change trims a slice of exposure you would otherwise carry.
If you're pregnant or planning, focus on the first trimester with extra vigilance. This is when placental structure, hormone signaling, and early organ formation are most vulnerable. Setting up filtration, swapping pans, and checking labels before conception, or as soon as you see a positive test, helps you protect those earliest developmental windows.
Here's your challenge. This week, set up one PFAS reducing water solution, reverse osmosis if possible, or a certified carbon filter changed on schedule. Replace one non-stick pan with ceramic or enameled cast iron, and add one daily serving of a beta-glucan food such as oats or mushrooms. Make those 3 moves and you meaningfully lower your ongoing exposure. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.